A very good afternoon. It is my great pleasure, and I admire and thank our beloved Professor Madan Mohan and Balaji for inviting me again this year. It's a privilege and honor. I very much appreciate it. At least once in a year, I associate myself with the yoga team. I wish to associate more in the days to come. And I strongly believe yoga and meditation, and for that reason, and for being good, I believe I am called again and again. I have two opening remarks in continuation to the previous speaker, and then I let the stage open for the panel discussion. Two things I disagree with the previous speaker. One, he said he takes 45 minutes to talk to the clients and try to get them understand their problems and treat them. I've been doing this for 25 years with my wife and I couldn't do it. And number two, he said there is no side effect with yoga therapy. Again, every time I go to my wife to teach her something, she kicks me. And that is a side effect. So yoga therapy doesn't work in all places. That is my understanding. And with that little note, I think I let the door open for a very serious discussion. All of these panelists are strong in what they do and what they practice and preach. And it is an honor to be here compulsorily to listen to them as well. I declare the panel discussion open. Please.
Thank you very much, sir. I think from sir's experience, what we learn is don't try to teach your wife or treat her. Here we have a very beautiful panel today, and we are discussing the integration of yoga with mainstream medicine. And in the morning we have heard how different efforts are being made, right from the year 2009 in JIPMER, where Professor Madan Mohan introduced yoga to medical students with a 60-hour yoga program, followed by a national workshop, at that time sponsored by Moraji Desai National Institute of Yoga under Ayush. Today this is a reality, but still the grassroots level, it's not come as we have wished it to come yet. And I think I would first like to pass the mic to my senior colleague, a respected elder in the field, Dr. Prakash Rao, who has been associated with the Ayush movement, the Indian systems of medicine and homeopathy movement, right from, I think, at least 4 decades now. And I think, sir, it would be nice for you to share some of the difficulties and successes that homeopathy has had in trying to integrate with this mainstream medicine. Thank you, sir.
Thank you, Ananda. Respected Dr. Madan Mohan, respected senior colleagues of the Institute, Dr. Ananda, Chairman of the session, Dr. Bhavanani. Now, today we are here in this, I guess, gathering for yoga or for Ayush as an integrated medicine means. Why we are forced to have this integrated approach in the medicine? What made us to think like this? Number one, any system of medicine means it is something dealing with the biology of the patient. Whether it is alternate system of medicine or it is yoga or it may be allopathic system of medicine. When we are dealing with biology, there definitely will be evidence based. But before allopathic system has evolved, what happened to the people from last 20 to 21 centuries? Have they died? What happened to the golden era of India when the healthcare was fantastically better? How they survived? What is the technology that was present in those days that has disappeared? I will tell you one example to make you to understand. Suppose if you go to Chidambaram, you will find the Chidambaram Natarajan temple. Then there will you find a big statue, a big stone a pillar which is carved a banana flower, Valapu. So when a sculptor has made banana flower over a stone, means he should be an artist, he should be a sculptor, he should be an engineer. There should be some engineer who has to assist him, guide him, and there should be some of the persons who have to help him. Number two, if we compare with modern physics, he has to use vernier calipers, screw gauge, everything, whatever the tools that are present today must be used in those days, in 9th century. Otherwise, the technology will not be present. So when such a technology is present, there should be some contemporary technology for him. Suppose a person who carries so many stones, there is every opportunity that he will meet with an accident, there will be fracture of bones, so there should be some orthopedic surgeon. Then he has to heal his injuries. Otherwise, such a monument cannot be completed within 10 to 15 years or within 50 years. So the contemporary technology has disappeared. Same thing with Ayurveda, same thing with Ayush. Suppose somebody was speaking about grey anatomy today. If we go to Ayurveda text, we will find in anatomy, embryology, physiological embryology, Shishu anatomy. Then anatomy of pregnant women, anatomy of women, anatomy of men, anatomy of children, anatomy at the old age. Even grey also don't have nowadays. The grey anatomy is in the same fashion pathology and physiology. When any subject starts, it starts from quackery. Same thing with Boyd pathology as with grey anatomy. Same thing with eye systems. So when we lost reasoning, when we lost how they have conquered the total world and how they disappeared, this is the reason, this cause we never understood. It may be due to natural calamities, may be due to wars. Otherwise, in Ayurveda, when they speak about physiology, anatomy, pathology and disease, there the pharmacology disappeared. When the pharmacology disappeared, we cannot frame the pharmacology with that tunes. In the same fashion, yoga was in the scriptures. Yoga was followed, yoga was taught by Sri Krishna to Arjuna in Bhagavad Gita. And he told that you meditate because Arjuna was going through fluctuations. So he need balance of the mind. Krishna will suggest him that perform yoga so that you will have balance of mind, whether to kill, not to kill. Today morning that the Professor Sethuraman told that Mother Teresa don't want to accompany the war. That is privilege on my part. We were accompanying Dr. Geetananda Giri from last 40 years to from 1975 to 1993. And when I am seeing him, I am remembering those days when Dr. Geetananda Giri vision used to have yoga in allopathic hospital.
First of all, I would like to thank the organizers to give me an opportunity to sit in front of you. Sir, integrating yoga in physical therapy practice is a wonderful thing. As such, physical therapy practice involves exercises. So exercises means a physical form of activity which our ancient rishis have spoken about in form of asanas, which has been widely discussed earlier in the past 4 or 5 days. As such, when we try to teach somebody some sort of exercises, we have a definite purpose, sir. In this process, physical therapy present practice has got a very limited amount of aims and objectives. But whereas if a therapist has some amount of knowledge about yogasanas, with its psychological implications and the philosophical background, it is easy for the physical therapist to address not just the physical part of a problem. For example, some patient comes with back pain. See, low back pain as such, it's a syndrome. It's not just an entity where you experience pain. Pain is not the only entity. It has got so many 1 to 25 innumerable problems. And as any two conditions are not similar, it is difficult to address all the patients in a group. So as a physical therapist, after a detailed interview and evaluation and a careful evaluation where you find it's a muscular imbalance, or it is a tactile difficulty, or there is a disconnectivity between the mental picture and the physical attitude, physical posture, it is very easy for the physical therapist to incorporate the philosophical background of yogic concepts in putting down to physical therapy practice, in bringing about a homeostasis from the physical and the mental aspect of any patients for that matter. Becomes to be very handy, sir. Like it's very, very useful. And like I questioned the previous speaker, what is the evidence? I was not doubtful. Rather, I am in a precarious situation where I'm doing my PhD, and being a PhD scholar is the most difficult job on earth, because you have to satisfy so many people in providing the evidence, tools, parameters, the statisticians, the X number of people. So I was desperate to ask the previous speakers because I was desperately wanting some sort of a structure, a framework, which I could like to adopt to my period of study, because I find so much of changes which is being brought to my patients, which I cannot go say to a crowd, by doing a Bhujangasana I am able to fight off fibromyalgia. By doing Paschimottanasana I am able to fight off.
Yoga, do you think could be useful in the integration? Is it more like the asanas or the mudras, or which part of it do you think?
Sir, everything for that matter, sir. Everything. For example, you see the common form of thing nowadays, a software professional, everybody has got a neck pain. I can definitely say here in this crowd, I could pick up more than 50% will have a neck pain. For that matter, I can say everybody's neck is placed in different attitudes. Positions. So if for me to correct the neck pain, I need to bring about a good amount of self-appraisal of your position. Okay, we call it as proprioception. So to bring about proprioception, I need to practice a mudra. I usually practice Brahma Mudra. Brahma Mudra is one thing which can bring about muscular control. Not only muscular control, muscular balance, joint position sense, and when you practice with mantra, then it has got whole lot of control on your own self, and whatnot. The last and the best part is the breath. You are aware of where the neck is. So just by the practice of Brahma Mudra, I'm able to control. I'm not saying I'm eradicating, I'm stopping, I'm curing. I never use that word. I'm able to bring about awareness. See, my neck pain is caused because of my own faulty position. If I understand that, I can easily tackle it. If I don't know, I keep jumping to doctors and physical therapists. I keep jumping to modalities and medicines, and there's no end to it. So the awareness part of it, every part of yoga can be integrated, can be converted into a useful module therapeutically, and it can fetch rich benefits for the patients.
I think that's very beautiful. You yourself are starting to understand that if I have a neck pain, as Mohanakrishnan was saying, by understanding that, okay, I can modify my position, that itself you're already starting to empower yourself. And I think it is a very beautiful concept, because I know of many of the patients at JIPMER and in other places who have benefited, especially frozen shoulder. I believe he's been doing a lot of work with neck pain, back pain. And I think this type of usage, as Dr. Prakash Rao was telling, the physician of the future is going to have to know at least a little bit of, I think, everything. Because this is what people are going to want. They want that you are going to give them something that will help them. And whether it comes from allopathy, whether it comes from physical therapy, homeopathy, yoga, what they want is to feel that sense of wellness. And I think even because survival of the fittest, that those who have this combination, they are going to start surviving more, and people who see that say, okay, that is the way to survive, and they'll automatically pick it up. Taking it to another level, I would like to ask Dr. Meena to share a few experiences of her work with the special children through Sadai School. We have Dr. Sugadam and Asha Madam here. And also with the senior citizens, two extremes that she has worked through. And her work at CYTER in JIPMER with the senior citizens, and then now the work we are doing here at CYTER in our own hospital.
Two broad ends of the spectrum, senior citizen and special children. It's very interesting. We say yoga is experiential science because you need to experience the changes. But I would say, to me personally, it's like the experience that I have gained teaching to this wide spectrum that has gained that experience to my personal self also. When we talk about the seniors, my experience there, I would say they are all mostly it is the attention deficit, because they seek attention, they want to be looked at, they want to be, asked, are you okay? They want to be cared. And I think in both the cases, I would say group practices are very
Great responsibility upon each and every one of us to take it forward. And I would like to share a very nice piece of news that the National Health Portal of the Government of India recently has put up a compilation of research studies giving evidence of yoga, and of the 108 references in that, I would like to proudly state that the work of Madan Mohan sir and our own team finds 13 references out of that 108. And that is the largest from any group of researchers. And to see that was a very great moment of pride that the Government of India is now talking about. We have been talking about evidence-based. Well, if people want evidence-based, we'll give them evidence-based also. And for those who want to have the experience-based, let us also give people the experience-based. So with these words, I'll hand over to our chairperson for his concluding remarks.
Philosophy, darshana, what they were referring to. And along with other words, hatha, mantra, and laya, referring to particular techniques of yoga. I like these three words, hatha, mantra, and laya, because I can integrate it with molecular biology and self. I'll not take time now. I'll do it with the team. If you are interested, you can talk to me. And yoga as a goal of yoga practice. These are the 5 meanings Jacobson has given for us, the real meaning of yoga. He wanted to share this with you. I think I have done that part. And for lack of time, I will not take much time. I appreciate the panel for the participation. And I request Professor Madan Mohan and Balaji to organize another session where the same panel sits for a deeper discussion. We'll learn more. It is, we'll learn more. And thank you for being patient, and I'll hand over this to session 2 back to the organizers. Thank you.